Hello again. We've got another video for you. Today we're going to be working a little bit more on the lower back, and I'll be explaining some things to you about that. Misalignment of the subtle structures is often the root cause of chronic pain, injuries, and chronically high levels of stress hormones. In this course, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures. The lower back, it's an area that does have a lot of complaints. It's an area that not only is connecting with the upper body, but a lot of this down here at the low back area, there's connections with the hips, the glutes, and the legs. So it kind of all ties together. So it's important to understand, how connected we are. And it's not just maybe one area, but we have to take it as a global unit, and then we can pinpoint things after that, especially if there's the proper alignment going on. Especially if the alignment has been done at a more subtle level. And so let me get the oil. I didn't get quite enough. I'm going to take it up the back a little farther, take it all the way up the back, because that is part of the connection, so I'll get a little bit in there too. Okay, so how the vertebrae is, that we have the thoracic vertebrae, which is where the rib cage is, and that runs down about to here where the end of the floating ribs are. And then the vertebrae changes to the lumbar vertebrae, which is down in this area, and that's the area that does get affected, although there is some counterbalancing oftentimes done with the upper body. Then we have the psoas muscle, which is in the hip, and it also works down into the hip flexor. It's also the hip flexor, but to lift our leg like in a marching position. But that also can affect, how the back feels. So sometimes when you are doing that, if it's not strong, you'll find that there's a little bit of discomfort, maybe lifting that area too. So it's important that the low back is paid attention to. The sacrum particularly, which is the last bone, it's right here. The sacrum is really important to be in alignment, particularly for the use of the legs, because when that's out to the side, you'll find it hurts a little bit. And so just the alignment is so important. That's just what we have to do, just like our automobiles. We have to have that alignment in the front wheels, or we wear tires out. So it's very similar to that. It's just maybe even like a law of nature. What I'm doing here is just getting the muscles softened with massage around this lower back. Karina did mention that she's got some back stuff going on. It's nothing super serious, but enough that it could become a little more serious if it stays out of alignment or stays held in a wrong position. And I'm going along the hip line here, and so the SI joint, which is a sacroiliac joint, the hip, the ilium in the hip, and then the sacrum, it's where they come together. The sacrum is kind of triangular shaped, and it goes to a point to the tailbone. And the better position that is in, the better position your whole back will be. Through my experience, I've discovered that most of the sciatic pain that I run across is just a misplacement, or a misalignment, I should say, of the sacrum. And once that sacrum is able to find its way back to the proper alignment, the sciatic pain goes away. And I have seen people that have been older people particularly, who have been confined to a wheelchair, who have been able to get out of the wheelchair, kind of take a stage with the walker, and then being able to walk again without it. And when they felt back pain again coming in, they would come in and we'd just correct that sacrum again. And it was pretty amazing when I discovered that, because sciatica is oftentimes people are addressing the nerve, the sciatic nerve, and they're not thinking about the structure. So that's just an interesting point that you can think about and see if that's happening to you if you have that pain. Sciatica usually runs down the leg, can go down to the foot. It's not comfortable at all. Okay, so here I've got these surrounding muscles here, pretty soft. And now I'm going to go again very slowly through each of these lumbar vertebrae and follow the muscle pattern outside of this erector spinae, and just take it a long kind of ride down the side, because I want to open all that up and have a little stretch going on, and just keep it going down. And then the next area. Now here I'm right along the hip crest. And then here I'm more onto the hip, but there's muscles there that are important, the gluteals and some of the low back muscles. They all kind of converge right there. There's a little bit of roughage that I'm feeling. It's like that washboard feeling. So kind of like an overwork, overuse, common thing. It's not anything that I don't see pretty regularly. It just gives me a signal that the muscle needs to be a little bit more ironed out. And I'm going to do the same thing on the other side, which I'm going to use these two fingers to slide down. And you can feel a little bit of the rib cage when you're going about there, but you don't want to get onto the rib cage. And it's with the floaters, so they run out as you go further to the side, go further laterally. And just kind of keep that going. It feels good to have them stretched. So as these muscles soften up, that in itself will give a lot of relief. But it won't get down to maybe the core issue, which is misalignment. Now I'm going to go up right through this lumbar vertebrae. Just keep going up and seeing the alignment of the lumbar. And that is really in an interesting pattern. Let me check the other side, and you can see if it's the vertebrae or just muscles. It doesn't feel like there's any major vertebrae out, but it does feel like there's a little subtlety to it of misalignment, right in this vertebrae particularly. That one seems to be a little bit sheared. And you want to think about that when the bones, when they get out of whack, that the discs in between them are going to have to do something to change their position a little bit as well. So I'm going down along the bone, and this is where the sacrum comes in, and I want to get into the top part of the SI joint. Yeah, it is very tight in there. Some of it is because of the structure and the more tendinous attachments, but some of it does feel like it's needing to have a little bit of help. So I'm just writing that up. And there's that, yeah, this does feel like it's a little bit of a bone out of placement, but not anything to any great degree. And when I go down there, yeah, it sinks back in. Yeah. So it's like there's two vertebrae. It's very subtle, so don't get really alarmed. It'll be able to probably work itself back in. But it feels like one bone is a little bit over to the left, and then the other bone had to counterbalance that, so it moved a little bit to the right. And after a while, that can cause some problems, but for the most part, oftentimes when you twist your back in a certain way or bend over in a certain way, oftentimes that will just put that back in when it's a little tiny misalignment, and you'll feel a little pop or something. That's the bones that found their own way back. They hadn't been gotten so held down by tissue that has, made a new pattern out of it. And I'm just keep on going back and forth because the muscles are ironing out. And now they're very smooth, actually, on this side. Yeah, I think now you can also grab a hold here and kind of pull back up to give a different direction. And draw them up. And then you can also do some kneading through here to just keep this whole area, get the whole area softened up, because that way the outer muscles won't affect the muscles that are closer to the vertebrae. And this is now feeling really different from before. It doesn't feel like a washboard, at least along here. Okay, I'm going to do this on the other side, which you're not going to be able to see, so I'll do this a little quicker. But this side isn't as, I don't know if it's because she's relaxed more or what, but this side never did feel quite as washboardy as the other side. Just wrapping this up. Okay. And then I'm going to knead over here. Okay, and now you can get to where the sacrum, where L5S1 is, which is right about here. And you can put the fingers in that little joint area and lay the hand on the sacrum. And then you can curl the fingers there and then just lay the rest of the hand on there and go up to about where the thorax is. See, there's a little bit of something going on. There we go. Oh, this is interesting. Okay, about right here, I'm just going to pull some traction with the dural tube here. And let that happen slowly. And as that happens, there'll be a little bit of shifting going on. There'll be a little, like, rocking from side to side, or I don't know. It's hard to explain what I'm feeling, but there is definitely movement going on. And the muscles are finding their way to a new pattern, which is not the way I would have thought that they would be, but because they move a little to the left and right, and then they make little circles, and then they stretch. And so it's the vectors of those that are happening. And it doesn't seem like a lot. It doesn't seem like it's anything thing too significant, but really when you think about it, it is, because it can get, it can get worse as time goes on. But it is overlooked a lot. These subtle anatomy stuff is always overlooked. In fact, sometimes just aligning people properly is not known. I have seen some massage therapists, when they're going to stretch the hamstrings, not pay any attention to the alignment of the foot and the knee and that alignment with the hip, and are also very forceful, not understanding how some people's muscles have to go slower, or they can only go so far because of them being very tight. And they've also pushed their way in and gone too far and actually caused a little bit of injury. So this is all along more the sacral area, where it is feeling very good. This was very washboardy when I started, and it's not at all. And another little stretch on the sacrum. Get the fingers in there. Pull. There we go. Now my fingers here are more at the lumbar vertebrae. So I'm just doing a little separating there, a little traction both directions. And there's some movement going on there too. The sacrum is got a little correction to do. Okay. Then you can kind of take my hands so I don't get too much. Then you can also just kind of knead the gluteus area and the hip joint area. And if you feel anything kind of extra tight, these are very big muscles. They're very strong muscles. They have to stand us up and sit us down and bend us over, and they're just partly involved. There's other muscles involved, of course, but they are very, very important muscles. And from my experience, when you lose a lot of this area, you can tell. It's really hard to sit down. It's really hard to stand up. It's really hard to walk. So it affects a lot. So just keep these muscles. These muscles are so large that they're usually just kneading them out is good, unless there's been some injury, because they tend to stay in a pretty straightforward positioning unless you're doing some kind of sports where you're twisting and bending a lot. But for the most part, they stay fairly stable in how their action is. Just make sure you're not feeling anything deep in there. Okay, and then sometimes it's really nice to just shake a little bit. Feels good. It's like little rocking. Just shake it. One other note I want to make is that this is working with the muscles, which are considered the more gross anatomy, because they call it that because it's outside. It's things that we can feel. But a lot of times, some of this work that you will do on the lower back or the upper back the problem goes into the subtle anatomy, and that's going to take the subtle techniques to be able to unwind that. And so if their problem keeps coming back and keeps coming back, check the possibility that it's a subtle work. And if it is that, then it'll correct out. Otherwise, it could be something else that's going on, some inflammation or something like that, or bone thinning or something else. So just be mindful of that. But the subtle anatomy, usually in most cases, is the one that's locking everything down. So if you could just remember that, and if you're interested in learning how to deal with the subtle anatomy, there is a course out that I have put together, and Karina and I have put together, and it's very informative about how to take the skill level from the gross anatomy to getting into the subtle anatomy. And when you do have that skill, if you're interested in that, you're going to be much more efficient in how your work is produced. They're going to have better results, and that's because of the stretching of the more inner core of the body, where you're getting actually inside of the vertebrae and working with the membranes that are inside of the body, so that the spinal cord won't be twisted in any way, because the spinal cord, when it's twisting just a little bit, it does put a hamper on the nerves that come out from the vertebrae. There's the nerves that come out there in little dural sleeves. And so if there's a twisting or a torsion at the subtle level, then the signal cannot be as strong, because it's crimped a little bit. So even though you are getting it, it's not going to be a full nerve stimulus to that area. And it doesn't really show up much. It's so subtle that you don't really notice it. But over time, you'll always just have this thing going on that you just always feel. And most people just decide that that's just the way it is, and they just have to live with it. So bear in mind that the subtle anatomy is a very, very important part to consider if you're hurting or if you want to help people to get out of pain. And then to end it off, you can just take these, the palm of the hand, and let this part of the hand be in the where the vertebrae is, and just move it up really slow and think of the energy. There's energy. You're pressing not with a lot of push, but it feels like the muscle is not pushing back on you, on the hand. So that's a good thing. You just want to have it where it's like an even push on the body and the hand, and go all the way up, 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 up to the top, and then doing a little bit in the shoulders just to kind of round it all out. Because sometimes when the low back is hurting, the shoulders think that it needs to become earrings to help. And just do a little bit in the upper back. And then you can take that back down, and then run that back up again. It's better to leave it up at the top, pulling that energy back up. Sometimes when you do this, you'll feel a lot of shifting going on along the vertebrae, the muscles of the vertebrae, that is. Okay, and that should loosen up that enough, and she should feel a difference in flexibility a little bit, and possibly sitting will be a little easier. And it feels all different than what we started. So that, I would say, the job was done. So if you're helping somebody with this, just remember, pay attention to what you feel when you first run across it, and then see how much it changes to the end, and then you'll know that you've made some differences for this person and their well-being. So thank you so much for viewing, and I shall see you in next video. Misalignment of the subtle structures is often the root cause of chronic pain, injuries, and chronically high levels of stress hormones. In this course, The Foundations of Subtle Alignment, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures.